Good evening, everyone. Andrew Wolf at the Center for Cosmetic Surgery with the second installment of my FAQs. Last time we talked about scheduling, specifically the challenges surrounding consultation timing and the surgical timing as well. Once people figure out when they might be able to get in for a consultation for surgery, inevitably the discussion leads to financial aspects of the surgery. It is obviously a sensitive topic for lots of people. It is something that we want to be transparent with. And so let's talk about that in a bit of detail. First and foremost, we do charge for consultations. And the reasons surrounding that have evolved over the years. When I started in practice 20 years ago, I didn't charge for consultations. My motivation at that point was simply to see as many people as I could. And what I thought was the more people who might be able to come in to see us, the more positive impressions you can make, the better. And even if somebody comes to see me and chooses not to have surgery, hopefully I've still made a positive impression on them. The praxis has impressed them, and they leave out into the community with, good vibes surrounding their experience with us. And then you hope that down the road, through sufficient positive experiences, you get a good reputation in the community. You have people who feel favorably towards you and your practice, and that kind of goodwill, I think, is great for a practice. Fast forward 10, 15 years, and we've gotten busier and busier. And so the point now is less to try to make a good impression, because hopefully I've got enough people out there in the community that there is some basis of goodwill for the practice. And what we're trying to do now is be efficient for everyone. And so if you charge for consultations, you're going to see fewer people who are less serious about the surgery. Somebody who is just contemplating surgery but doesn't really have a plan, has really no set schedule, isn't sure even if that surgery is something that might work for them anatomically, financially. That's not necessarily the kind of patient we want to see at this point. I'm more leaning towards having people come in who've done their homework, who have maybe narrowed it down to 2, 3, sometimes 4 surgeons that they might want to interview. And they're willing to now invest financially in that time. And so part of the reason why we charge for consults is to weed out people who aren't that serious about the surgery. In addition, it creates a sense of value for the experience that a patient gets when they come in to have that consultation. Anything that's free, there is a subconscious, sometimes conscious, feeling that if it's free, it can't be worth that much. And so instead, if something is costing you, you're more likely to place value on it yourself. It's a pretty basic psychological principle. And so by charging, we are creating a sense of value around the consultation experience. At the same time, I better deliver something for that value. And so, as I said during the last episode, this is not going to be some 5-minute meeting with me. And then otherwise you're spending time with people in the office. This is a really intensive discussion between you and me, our patient counselor staff, the point of which is to help you figure out whether you're a good candidate for surgery, help me figure out similarly whether you're somebody that I can operate on and have a very high likelihood of making you happy. Right, that time is valuable. I defy you to find any professional nowadays who is going to give you an hour of their time. Maybe an attorney who works on commission. Outside of that, if you're going to meet with a lawyer, an accountant, whoever it may be, their time is valuable, and so you're going to pay for that time. I have chosen not to have that cost applied to surgery, and that's a bit of a distinction versus some of the other practices in town, where whatever the fee may be, $75, $100, $150 that you're paying for the consultation, that can get applied to surgery. I don't do that because I don't feel that the consultation has value only as it applies to future surgery. I think that the consultation, and hopefully anybody who's been in to see me for a consultation will agree, you're going to leave better educated than when you came in. The time is valuable for me, and it hopefully, again, provides value for you, independent of whether you choose to have surgery. Every now and again, I'll have somebody who comes in, and they're clearly not a candidate for surgery, and what they thought was reasonable, either physiologically or emotionally, financially, just absolutely doesn't work for them. In those cases where it's a quick experience and I don't feel right charging, somebody will refund that fee. But by and large, you're going to come in, hopefully have a consultation experience that is worth both your time and my time. So that's the consultation fee. Surgical fees are independent of that, obviously. And again, we're on the upper end of the spectrum. We're not the most expensive. We're certainly not the least expensive. And the pricing is not simply arbitrary. We're not just charging what we think we can charge. There are costs baked into that total price of whatever surgery you're going to get. Obviously, the pandemic has increased the cost of many products and services. And so we're paying more for products that were less expensive several years ago. Everything, energy, keeping the lights on has all gotten more expensive. So that's part of the basis of the cost. Staffing at our office and at most medical practices is the most significant cost that we pay. And for those of you who are not in healthcare, you have a sense that prices have gone up. For people who are in healthcare, especially nursing, nursing as a profession right now is being crushed by COVID. And because of challenges in hospital staffing and patients who are needing more and more care, there's a significant nursing shortage. And because of that shortage, nursing talent is at a premium, and we have to pay the going rate for what a nurse can make at the hospital. And it's gone up dramatically. In some cases, nursing costs are double what they were 2 years ago. So that is another source of our increasing pricing. Finally, I've been in practice for 20 years. And so the longer you do things, the better you get. Hopefully, you're providing a service that is of a greater value to people. I certainly feel that I'm a better surgeon now than I was 20 years ago. And so with the increasing quality of the product, really, the prices go up. At the same time, I do think it's very important to separate the price of something versus the value that you're getting for something. And just like there should be value in the consultation, there should be significant value in whatever surgical experience and result you're going to get. And so, yes, it's expensive, but you can look at what you're getting. You should be getting a top-notch surgical result with, all-inclusive care from the beginning all the way through and including follow-up. What you're also going to get that's different from our practice, from many other practices, is essentially a guarantee, without using that word, that we're going to make your result as excellent as it can be. And so I don't charge for revisions. We don't charge surgical costs. I don't charge operating costs. There's no anesthesia fees. I will eat the entire cost of a surgical revision if it's something that I've done for you that could be improved, and we both agree that there is improvement to be had. Then that's on me. I defy you to find another practice who's as enthusiastic about that process as I am. And my sense is that people are spending a lot of money and they're putting a great deal of faith in us to get them the result that they want. And it's incumbent upon me to make good on that promise to you, so that if something doesn't work out as perfectly as it could, and unfortunately that can happen sometimes, I've got to do what I can to make it better. Okay. So that cost is built into the surgical fee. And what it does is really indemnify you against a second hit that can be very, very expensive. And many times if somebody has a result that's not great, they have an implant that's not in the right place, they have an infection, there's bleeding, a scar's not great, whatever it may be, there may be significant costs associated with the revision. You're not going to get that at our practice. And so although it might be a little bit more expensive up front, there isn't going to be an unpleasant surprise down the road if you don't feel that your result is worth the price you paid for it, and it could be improved. So that's where we are. It's really a complete package, including everything. Another cost that's built into this is operating room fees, and so fortunately we own our facility. We have our own fully accredited surgical facility, and that's been a tremendous benefit during the last couple of years of this pandemic, because hospitals are less safe places to be. There are staffing shortages. There are sometimes seemingly unreasonable mandates from the state or federal authorities in terms of surgeries that hospitals may be allowed to perform. And so if you're a surgeon who operates at an outpatient surgical facility and they are prioritizing different procedures than the cosmetic cases that we do, you may not have access to the operating room. And that happened actually a couple months ago. And I have good friends in town who had no place to operate, and they're calling us to see if they can get into our surgery center. And unfortunately, we don't have room to bring in outside surgeons, but it really highlighted the benefit of having our own place. it is expensive to build, run, and staff a surgical facility. And so again, that's all built into the costs. What you do get is I have an opportunity to operate at some place that is safe, where the staff knows me, they're my instruments, everything goes exactly the way I want, which if you work with me, you will appreciate that that's very important to me. We have a facility that is, as a facility dedicated to cosmetic surgery patients, it's a very different experience than you're going to get even in a nice outpatient surgical facility. They may be doing a variety of cases, and there can be podiatry and hand and GI and urology and whatever it may be. Ours is tailored specifically to do what I do. Every nurse is there because they are handpicked to be there. And so we never have staff that are unpleasant or overburdened because we're controlling the staffing. We are only choosing to partner with nurses and other providers who are excellent at what they do and align with our interests and the patient's interests with regards to providing a really seamless, safe, and pleasant experience for the patients. We are always transparent with pricing. You're welcome to call. You can, we'll tell you on the phone if you're considering a given procedure. We'll tell you what the price is within a given range. Obviously, to narrow that down, you might need to come see us, and we have to figure out specifically exactly what surgery you're talking about. If there's an implant involved, there are a variety of different implant types, and they may come with different costs associated with them. Duration of surgery, all of that factors into it, but we can give you a range on the phone. And if you come see us, I can give you a very, very specific quote on the surgery that you might be considering. Quotes are good for 6 months, but if you've got questions about it, just reach out. I'm always happy to discuss any of this. As I said, we are as transparent as we can possibly be with it. And I do like to, at least to myself, be able to justify everything that we're doing. So I'm happy to pass that information on to you. Hopefully, this provided some answers for a very commonly asked question that we get surrounding pricing. If you would like further detail, don't hesitate to reach out. And I will see you next time during another episode of the FAQs. Andrew Wolf at the Center for Cosmetic Surgery. Until next time.